Hello Rajani, how are you?
I'm fine, and you?
I am fine. My name is Pravina and I am RN in this hospital. Today we are going to talk about the topic of burn and its management. Do you have some time for me?
Yes, I'm free.
Okay. Do you know the what is burn means?
I think a burn is an injury to the skin which is caused by fire.
It is true. And similarly, the definition is the injury or the damage of the skin or the part of the skin due to any heat or fire or the any chemical or the electricity is known as burn. And do you know the types of the burn?
I don't know the actual types, but it may be minor or major one, I think.
Yeah, it is simply defined as the classification of the burn, the minor and the major. But according to the medical or the medical term, it is classified into three groups. That is the first degree burn, second degree burn, and the third degree burn. According to the degree is defined, and in the first degree there is only the burn will be caused in the upper layer of the skin, in which the redness and the dry and the painful the some blister may be appear, and they cannot be as a serious one. And the management for them is we can do in the home care, that they will disappear the sign and symptoms within the few days, and there we should not do any management, or you can use the ointment for the treatment. And second one is the second degree burn, and it is a major or the severe burn in which the not only the upper layer but the inner part of the skins are damages, like the tissue and the muscles. And in this it can also form some blisters and extremely red and sore to the burn area. And the treatment for this mild or the second one degree is that, and we can use a running water to prevent the skin which is burned for the 15 minutes. And if we can't bear the pain, then we can also use the ibuprofen for it. And also they are applying the antibiotic for the blisters to prevent it from the further form of the blister formation. And the last one is the third degree burn, which is known as the severe burn, in which there is no any pain because of the every nerve damages. It will touch to the root of the skin layer and as well as to the bone. And in this degree or in this burn, they can show the dark brown color, lethargy textures, and the blister that do not be developed because there will no any part will be remain to form the blisters in this place. And then never apply any self treatment in the third degree. As soon as possible we have to take the patient to the hospital. And it also carries the risk of hypovolemic and hypothermia. We have to observe the patients very carefully in this condition or in the third degree of the burn. And we can treat the third degree burn by protecting the burn portions from the external side, and remove the jewelry, belt or any tight thing from their body, and cover the burn area by the light one cloth or something, so that it will not form the any other infection can cause. And also watch for the sign and symptoms like the hypothermia, hypovolemic. If any cause or not, we need to observe this one. And also observe the sign of the shock, and then the patient will be shifted to the hospital as soon as possible. And also it is managed well in a hospital by doing a surgery, physiotherapy, and sometimes can be taken to the rehabilitation. These are the classifications of the burn and its management. Now I hope you will know about whenever someone asks you about the types of burn, you can answer it very well. Do you have any questions regarding this?
No, now I can fully understand.
Thank you so much for giving me your 5 minutes.